hospitalized in Minnesota after suffering from symptoms of severe lung disease. Doctors say is potentially linked to vaping.
Yeah, the state's Department of Health is urging parents to talk to their children about the risks of e-cigarettes. Fox's BZ O'Neilly reports.
The Minnesota Department of Health issuing an alert about vaping after 4 metro area teenagers fall seriously ill. The teens all treated at Children's Minnesota for severe lung disease, with symptoms landing some patients in intensive care.
We really are in the beginning of this investigation. We're trying to really understand what is going on, what may have happened.
State epidemiologist and MDH medical director Dr. Ruth Linfield is digging for answers. One thing for certain, the teens all have a history of vaping.
In our cases, the teenagers presented with shortness of breath, with cough, with fever. Some had gastrointestinal symptoms such as diarrhea, vomiting, nausea.
Headache and dizziness are also symptoms. Dr. Linfield says e-cigarettes contain nicotine and other chemicals that can be harmful.
There are some that can be cancer-causing. There are heavy metals. There are sometimes small particles that can lodge in the lung and cause damage or inflammation.
The Minnesota case is similar to what's been reported in Wisconsin and Illinois. In 2017, the Minnesota Youth Tobacco Survey found that nearly 20% of high school students used e-cigarettes and 40% have tried them. The U.S. Surgeon General calling vaping among youth an epidemic.
For young people, vaping is unsafe. We're seeing a lot of vaping occurring in teenagers. And we do hope that parents will sit down with their kids and discuss this. We know it's a hard conversation to have, but we think it is important.